Okay, so now let's put some of these tips into action, and I'm actually going to show you in a mind map format briefly what we have talked about. Okay, so essentially we're looking at studying tips, and of course the first question you really want to ask yourself is just be a little bit philosophical here or as existential, right? Why study? Okay, of course the obvious answer is that you want to gain a solid knowledge base. In a discipline like medicine, really knowledge is power, knowledge is key. What do you want all this knowledge for? And then essentially what we really want is of course to come up with the right diagnosis, the right treatment, and then ultimately the best possible patient outcome. So as what I mentioned earlier on, patient is really at the beginning and it is at the end of everything. Okay, we want to do our best for the patient every possible time. So that is why we study. Now, in terms of studying tips, I mentioned two main things. One is you really want to keep the big picture in mind as far as possible. With the big picture, little bits and pieces that we study will appear less disembodied. And it also helps us to remember our facts if we know how things link up with each other. So one of the tools to keeping the big picture in mind is like what we're doing now, which is create mind maps. And I find this very, very useful because it helps you to emphasize relationships between facts, between processes, between morphology, between clinical manifestations of disease. Right? The other tip that we looked at was ask questions. Okay, so you really should try to curb the urge to just look at your books or look at your notes from page 1 to page 100. It's very tempting to do that, but before you do that, just pull back, ask yourself a few questions. So I'll give you an example. If you're looking at systems-based topic, maybe cardiovascular system, right? So if you're looking at systems-based topic, one thing to do is you really want to ask yourself, what is the normal function of this system? What is the normal anatomy? And if you have enough brain space, what is the normal histology? Because if you know what is normal, it helps you to build on what are the clinical signs and symptoms when things go wrong. Okay, so always know what is normal. And then next question you want to ask yourself is, what are the common disease conditions or the diseases within this particular system? And this is where it starts to become a little bit knowledge heavy. So one of the tools that you can use to try to remember this better is to classify. Okay, so I mentioned one very useful tool is to try to break things up into smaller categories. And then within each category, you can further break it up. So it's a bit easier to remember rather than remembering 20 disembodied conditions. And I'll talk to you a little bit more about classifying later. Then when you are dealing with specific diseases, what questions do you want to ask? You want to ask yourself, what is the definition of this disease? For example, if you're dealing with ischemic heart disease, what is the definition? If you're dealing with angina, what is the definition of angina? What does it constitute? This will help you to understand the pathogenesis. So the next question you really want to ask yourself is, what is the pathogenesis of this specific condition? Pathogenesis will cover why this condition occurs, meaning the causes, and it will also cover how this condition occurs, meaning all the events that add up and that lead to the final clinical picture. Then what is useful, which is what we teach you in pathology, is also you want to know a little bit about the morphology of this condition. So we start off with cellular morphology, microscopy, how do the diseased cells look. Again, for this, you really should have an idea of what is normal so that you can know when something is abnormal. And the cells will add up to tissues and organs, right? So you also want to know what is the macro or what is the gross appearance. If you understand how a diseased abnormal organ looks, it is one step closer to understanding how the patient will present clinically. Which brings us to the next question, which is, what are the clinical features of this condition? So what you want to know is, what are the signs, what are the symptoms that the patient presents with, clinical signs, what is the clinical cause of the disease, what is the natural history, what are some of the complications of this condition if it is not treated or if it's left to go on. And understanding something about morphology will really help you to extrapolate into the clinical picture. And as you become more senior, you will also learn about what are some of the tests, what are some of the investigations that we can do to give us the right diagnosis, and also some of the treatment protocols. But this will probably come in your later years when you're more senior. So just to focus on the classification, something that can help us to classify is this mnemonic that I mentioned, vitamin C and D. Okay, so this will help you to go through the major categories, and it follows the etiology, so it's also quite useful when you're looking at pathogenesis. So let's just quickly go through what each letter stands for. So V stands for vascular, for example, ischemic heart disease in the cardiovascular system. I stands for infectious. T stands for traumatic or physical injury. A stands for autoimmune. M stands for metabolic. The other I stands for iatrogenic, which is caused by medical treatment or intervention, or idiopathic as well, which means that we don't actually know the cause. N stands for neoplastic, which of course refers to tumors. C stands for congenital. So as you know, in the cardiovascular system, there's a whole group of congenital heart diseases. It also incorporates genetic conditions. And then D, lastly, stands for degenerative. So if you remember these etiological categories, within every organ system there will be conditions that fall into these categories that will help you to not miss out any of the main diseases within each organ system. So essentially this is a simple mind map to show you not only the process of how to create a mind map, but also to hopefully help to consolidate some of the study tips that you can apply as you go along. So all the best. Hopefully when you actually come up and become doctors and start treating patients, you will find it useful, and it will all come together as to why you have to spend so many hours poring through your books and trying to build up your knowledge base. Okay, so I will sign off now. All the best and bye.